In the heart of West Africa, a story of resilience, innovation, and transformative leadership is unfolding. Captain Ibrahim Traoré, Burkina Faso's young and dynamic leader, has embarked on a mission to redefine his nation's future through an ambitious healthcare revolution. At a time when global conversations about development often focus on challenges, Burkina Faso's strides under Traoré's leadership offer a compelling narrative of progress. His recent announcement to construct 55 modern hospitals alongside mobile medical units and a state-of-the-art pharmaceutical facility has captured the attention of the continent and the world. This initiative is not merely about infrastructure, it is a testament to what visionary governance, strategic planning, and a commitment to public welfare can achieve. Burkina Faso, a nation historically grappling with limited resources and geopolitical challenges, has long faced hurdles in providing adequate health care to its citizens. For years, access to quality medical services was a luxury reserved for a privileged few, while rural communities and low-income families struggled with exorbitant costs and inadequate facilities. Maternal mortality rates remained alarmingly high, preventable diseases claimed lives unnecessarily, and the healthcare system strained under the weight of underfunding and logistical challenges. Against this backdrop, Captain Traoré's rise to leadership marked a turning point. Since assuming office in 2022, his administration has prioritized healthcare as a cornerstone of national development, recognizing that a healthy population is essential for economic growth, social stability, and long-term prosperity. One of Traoré's first acts as leader was to address the financial barriers that prevented millions from accessing medical care. In a bold move, his government slashed hospital fees by over 50%, a decision that immediately alleviated the burden on families. Even more transformative was the elimination of a long-standing requirement for patients to pay an $800 deposit before receiving critical treatments such as cancer therapy or kidney dialysis. For a country where the average annual income hovers around $900, this policy change was revolutionary. Overnight, healthcare transitioned from a distant dream to an accessible reality for Burkina Faso's most vulnerable citizens. But Traoré understood that affordability alone could not solve systemic issues. He recognized the need for a comprehensive overhaul of the healthcare infrastructure itself. The launch of 55 modern hospitals across Burkina Faso is the centerpiece of this vision. These facilities, strategically distributed to serve urban and rural populations alike, are designed to bridge the gap between need and access. Each hospital will feature specialized units, including intensive care wards, hemodialysis centers, and advanced diagnostic labs equipped with cutting-edge technology. In regions where maternal and child mortality rates have been persistently high, these hospitals will offer prenatal care, neonatal services, and emergency obstetric interventions. For communities battling infectious diseases like malaria and tuberculosis, the inclusion of molecular diagnostic tools ensures faster, more accurate treatment. The scale of this project is unprecedented in Burkina Faso's history, reflecting a commitment to equity, ensuring that no citizen, whether in the capital of Ouagadougou or a remote village in the Sahel, is left behind. Innovation has been a driving force behind Traoré's healthcare agenda. Among the most groundbreaking initiatives is the deployment of mobile hospitals, fully equipped medical units mounted on trucks capable of traversing Burkina Faso's rugged terrain. These mobile units bring doctors, nurses, vaccines, and surgical equipment to communities isolated by geography or insecurity, particularly in regions affected by jihadist activity. For many villagers, these rolling clinics represent their first interaction with professional healthcare providers. The impact is profound. Children receive vaccinations, wounds are treated before they become life-threatening, and chronic conditions like diabetes and hypertension are managed proactively. This mobile healthcare model, tailored to Burkina Faso's unique challenges, demonstrates how creativity and local knowledge can overcome logistical barriers. Equally significant is Traoré's push for pharmaceutical self-sufficiency. In early 2025, Burkina Faso broke ground on a pharmaceutical manufacturing plant in Ouagadougou, aimed at producing generic medications locally. This facility will reduce dependency on imported drugs, which often come with high costs and supply chain delays. By manufacturing antibiotics, antimalarials, and essential vaccines domestically, the government can ensure a steady, affordable supply of medicines for its hospitals and clinics. The long-term vision extends beyond national borders. Traoré has expressed hopes that Burkina Faso could one day supply neighboring countries with low-cost medications, fostering regional collaboration in healthcare. This project underscores a broader philosophy of self-reliance, where Burkina Faso leverages its own resources and expertise to meet its people's needs. Financing such an ambitious agenda required a radical rethinking of governance. Traoré's administration adopted a model of fiscal responsibility, redirecting funds from non-essential government expenditures toward public health. By streamlining bureaucratic processes, reducing military spending, and implementing stringent anti-corruption measures, the government freed up resources for healthcare infrastructure. Allocating 12% of the national budget to healthcare, a significant increase from previous years, demonstrated a clear prioritization of citizen welfare. This approach highlights a fundamental truth. Even nations with limited financial means can achieve remarkable progress when resources are managed transparently and with purpose. Burkina Faso's ability to fund these projects without relying on external loans or aid challenges the narrative that progress is contingent on foreign intervention. The success of Traoré's healthcare reforms is also rooted in his emphasis on education and workforce development. Recognizing that world-class facilities require skilled professionals, the government launched scholarships for medical students and partnered with universities to expand training programs. Nurses, technicians, and specialists are being prepared to staff the new hospitals, ensuring that Burkinabe talent drives the nation's healthcare transformation. This focus on human capital has created jobs, inspired young people to pursue careers in medicine, and instilled a sense of national pride. The message is clear. Burkina Faso's future rests in the hands of its own people. Captain Traoré's leadership style, a blend of pragmatism and idealism, has resonated deeply with citizens. His hands-on approach, including visits to construction sites and dialogues with rural communities, contrasts sharply with the detached governance often associated with political elites. By listening to grassroots voices, Traoré's policies address the real-world needs of farmers, mothers, and entrepreneurs. This connection to the populace has fostered trust and collaboration, turning the healthcare initiative into a collective national endeavor. The international community has taken note of Burkina Faso's progress. While Traoré's model emphasizes self-reliance, it also welcomes partnerships built on mutual respect. Collaborative ventures with global health organizations have facilitated knowledge exchange, technical training, and research into tropical diseases. For instance, partnerships with European universities have enabled Burkinabe doctors to specialize in fields like oncology and cardiology, while foreign engineers have assisted in designing energy-efficient hospital infrastructure. These collaborations, framed as equitable exchanges rather than dependencies, reflect a nuanced approach to international engagement, one that prioritizes Burkina Faso's sovereignty while embracing shared expertise. The implications of Burkina Faso's healthcare revolution extend far beyond its borders. In a continent where many nations face similar challenges, Traoré's achievements offer a blueprint for what is possible. Ghana, for example, could draw inspiration from Burkina Faso's mobile clinics to reach remote communities in its northern regions. Nigeria, with its vast population, might replicate the pharmaceutical manufacturing model to address drug shortages. Kenya's efforts to universalize healthcare could benefit from Burkina Faso's emphasis on cost reduction and infrastructure equity. While each nation's context is unique, the core principles of prioritizing public health, investing in local capacity, and fostering innovation are universally applicable. Critics have occasionally questioned Traoré's rapid consolidation of power and the militarized nature of his administration. However, even skeptics concede that his results, lives saved, hospitals built, and hope restored, speak volumes. In a region plagued by political instability, Traoré's ability to deliver tangible improvements has bolstered his popularity. The healthcare initiative, in particular, has become a symbol of national renewal, proving that effective governance can transcend ideological debates. For the people of Burkina Faso, the changes are deeply personal. In villages where clinics once consisted of a single room with minimal supplies, the new hospitals represent safety and dignity. Women who once faced childbirth without medical assistance now have access to prenatal care and skilled midwives. Farmers injured in accidents can receive prompt trauma care instead of enduring hours-long journeys to distant cities. Elderly patients managing chronic conditions no longer face the impossible choice between medicine and meals. These individual stories, multiplied across millions, illustrate the human impact of Traoré's policies. Looking ahead, challenges remain. Security concerns in the Sahel region, economic pressures from global inflation, and the logistical complexities of maintaining 55 hospitals will test the sustainability of these reforms. Yet the foundation Traoré has laid, a functional healthcare system, a trained workforce, and a culture of accountability, positions Burkina Faso to navigate these challenges with resilience. The government's commitment to continuous improvement, including plans for expanding mental health services and combating malnutrition, signals a long-term vision for national well-being. Captain Ibrahim Traoré's story is still unfolding, but its lessons are already clear. Leadership rooted in empathy, innovation, and a relentless focus on the public good can transform societies. Burkina Faso's journey from healthcare scarcity to abundance challenges outdated notions of what African nations can achieve. It is a narrative not of defiance, but of determination, a proof that progress is possible when leaders dare to put their people first. As the sun sets over the Sahel, casting golden light on the newly constructed hospitals and bustling mobile clinics, Burkina Faso stands as a beacon of hope. Its experience reminds us that even in the face of adversity, human ingenuity and collective will can forge a brighter future. For Africa and the world, Traoré's legacy may well be a reminder that the path to development is paved not by rhetoric, but by action. One hospital, one life, and one community at a time.